I am
Yes.
Dr. Shukorov from Uzbekistan. Currently, I am the fellow. I'm doing fellowship in the Fujita University Bantane Hospital in cerebral vascular disease. Now I'm going to share with you the presentation about the role of computational fluid dynamics in neurovascular conflicts. So what is CFD? Computational fluid dynamics is a branch of fluid mechanics that use numerical analysis and data structures to analyze and solve problems that involve fluid flows. Neurovascular conflict involves vascular compression to the nerve, and arterial compression may contribute to the pathogenesis of trigeminal neuralgia and hemifacial spasms. Simulation of blood flow patterns is anatomically realistic models enables to analyze the hemodynamic characteristics in cerebral vascular disorders, such intracranial aneurysms, neurovascular conflicts, atherosclerosis. So why is CFD required? It's available methods, MRI, 3D imaging, TOF MRA, SWI sequence, are static methods. And neurovascular conflict is a dynamic pathology. That's why sometimes MRI cannot identify the offending artery. Artery passes through the nearby trigeminal nerve without obvious contact, multiple vessels contacts, compressions. This is the four main parameters of computational fluid dynamics. The first one is wall pressure, is a perpendicular force. The second is wall shear stress, is a tangential force, is usually described as a frictional force on the viscous blood, which can act on the endothelial cell. Streamline velocity, the third, and the last one is flow vector. Our study included 10 patients in Fujita Health University Hospital, and among them, 7 of them with trigeminal neuralgia and 3 hemifacial spasm. And during these cases, were done CFD analysis to intraoperative findings. This is a video of right microvascular decompression of the patient. You can see in this video this is a trigeminal nerve, and this is a offending artery, superior cerebral artery. Was done the interposition at 3 points. In this case, you can see the interposition with the substance of Teflon was done in this case in 3 positions. In that positions with a compression, neurovascular conflict places. Putting the Teflon between the offending artery and trigeminal nerve. Was done the ICG and intraoperative findings were compared with the CFD findings. So after comparing, correlation was found between CFD changes. This is CFD, which describes the flow, streamline flow of the offending artery, superior cerebral artery. This is a wall shear stress of this artery. This is intraoperative finding. You can see that in this case, neurovascular conflicts places in these hotspots are correlating with this place, with these hotspots in wall shear stress and in streamline flow. And this is a preoperative 3D fusion of this patient. So we can find that these parameters are correlating with each other preoperatively, intraoperatively, and in CFD changes. So high wall shear stress correlated well with, and we see intraoperative findings in 8 out of 10 cases. Streamline flow correlated in 7 out of 10 cases. Wall pressure changes and flow vector showed no positive correlations. And as a discussion, we studied other articles. For example, one of them is the article of 13 consecutive patients was done by Tema. And of the 13 patients, offending artery had high wall pressure in 12 and increased wall shear stress in 9. You can see in these cases high wall pressure and high wall shear stress. And in the contralateral, in the control artery, these parameters are low. And the next case was done by Yamada, and in this case he studied the mean wall shear stress ratio of the arterial NVC group, and he found the focal elevation of wall shear stress at the site of the NVC, which suggests that symptomatic arterial compression was identified as a unique parameter that could be the reason for this trigeminal neuralgia. And the last one is 20 symptomatic TN trigeminal neuralgia and hemifacial spasm patients. In this case, where described the wall shear stress at the proximal part. You see in this case proximal part. This is the just beginning part. This is the contact site. This is the distal part. And in this case, you can see that in the junction part, in the contact parts, there are high wall shear stresses, which high magnitude of wall shear stress along the NVC compared with the surrounding site of neurovascular conflict. According to this study, a high wall shear stress ratio, which indicates focal elevations of wall shear stress as an NVC site, at the compression site, could be the potential to identify symptomatic compressions. As a conclusions, we can say that computational flow dynamics can provide additional insight into exact location neurovascular conflict. And the hemodynamic features of the wall shear stress may play a role in the preoperative evaluation of specific areas of conflicts in patients with trigeminal neuralgia and hemifacial spasm. And of course, larger sample size and randomized analysis is required for further evaluation. Thank you very much.